Hello, I'm Dr. Jackie Barker, and this is a short video about a recent BMJ Open article that we've written about the number of roles that public contributors adopt when they get involved with a health organisation. We found that public contributors adopted 9 different roles, and that's much broader than the most common one that we all know about, which is lived experience. So a second role that we found was when public contributors bring along their occupational knowledge. So for example, one of the public contributors in our study had experience in PR and was able to advise their project how to make their project newsworthy for local media outlets. A third role is occupational skills. So for example, a lawyer who was in our study didn't use her legal acumen so much as she used her sharp eye for detail. So she was able to contribute to a much more rigorous analysis being done by the project through her very close questioning. A fourth role is patient advocate, and most powerfully, this is when patients don't speak for someone else, but they constantly ask members of staff whether their project involved patients or the public, and therefore allowed those patients and public to speak for themselves within that project. A fifth role is keeper of the public purse, and this is where public contributors keep an eye not just on the budget but all of the resources. So for example, we heard a public contributor ask a lot whether or not the project needed to reinvent lots of things for themselves, or whether there weren't materials that had already been generated elsewhere that they could get access to freely in order to save resource. A sixth role we've called intuitive public, and this is where the public contributors trial or guinea pig materials or events or sessions or training on behalf of members of the public and give their feedback as to how it might be received. A seventh role we've called fresh-eyed reviewer, and this is where members of the public review materials and make suggestions and give feedback on how it might be changed and improved. An eighth role is critical friend, and this moves away from just reviewing material that's been put in front of the public contributor and moves on to making new suggestions. For example, we saw this very effectively deployed when a member of the public would keep asking the professionals in the project whether or not what they were doing really met with the aims and objectives that they'd originally started out with. And then the final role is that of boundary spanner. So some public sector institutions can become very siloed and not look externally very much and not work with other institutions that might be doing projects in the same area. And so the boundary spanner is constantly challenging members of the organisation to look outside for themselves and find ways of working effectively with other organisations. So our message here is that public contributors are not limited to a lived experience role. There are at least 9 different roles that we have observed for public contributors to play.